Thank you for joining us for today's webinar, Navigating Perimenopause and Menopause, How Empowering Women's Health with Medical Fitness. I'm Marianne Murphy, Vice President here at the Medical Fitness Association. I'd like to take a brief moment to introduce today's presenters. Raina Childers-Richmond is a registered dietitian and certified health coach. She developed, facilitated, and managed outpatient adult, pre-surgical, adolescent nutrition, and weight loss service lines in 2 medically based fitness centers south of St. Louis, Missouri for 18 years. As the Director of Partner Success for Health One, Raina has helped medical organizations around the country establish or expand service lines that supported increase in non-dues revenue. And Jack Hembree is the Director of Operations at 2 Mercy Fitness Centers. He's been with Health Point Fitness, Mercy Fitness for over 17 years. He holds a bachelor's degree in health and physical education / fitness from Northwestern State University and a master's degree in exercise physiology from Louisiana Tech University. Now, today's webinar is sponsored by Health One, creators of nutritionally complete meal replacement products and turnkey, comprehensive, and tailorable health improvement solutions, partnering with you to positively impact the health of your communities and organizations. Now, if you have any questions as we move through today's webinar, please type them in the chat or the Q&A section of your toolbar, and all questions will be answered at the end in the order they were received. Okay, Raina and Jack, take it away.
Hi, thank you so much, Marianne. We are excited to be here. We did want to sort of start with a quick question. There is a place where you can send up an emoji or respond in the chat to our question. So please feel free to do that. If you are a woman or know a woman, would you please send up an emoji or put something in the chat? All right, we go. We got some emojis coming. Great. Well, if you are a woman or if you know a woman, you are in the right place today because we are excited to talk about women's midlife health. Just a quick introduction. So the majority of my career, I was privileged to work with women who were coming for support during this particular time of their life and had been openly honest with all of the challenges that they were experiencing. And I'm just so grateful for their sharing and just enlightening me about it, because as I now sit in this same window of time personally, I'm super grateful for their insights and am very excited about the attention that is now being focused on women's health, particularly around this time of their life. And I'm excited to see it move into an opportunity to normalize and support this very important time of our lives, and happy to be here today. And Jack, did you want to share anything?
Yeah, sure. I'm probably not the normal face that you might expect to see on a discussion about menopause. But just to kind of let you know my background and kind of why this is a topic that I feel strongly about. First off, my program here in Southeast Missouri, about 70% of our female participants are over 40, and about 34% of our total membership is in that same category. So for my work, it's very important that I spend time on this and deal with this issue in a programmatic way. So I think that's one thing that makes me eligible maybe to be in this discussion today. Another reason is because my background and what I currently do really kind of engages my coach's heart. I mean, I get super excited about all the successes that our participants have. Endocrine disruption is going to affect potentially every cell of the body and every system, and because of that, it's a difficult thing for people, and seeing people overcome and actually thrive in that is something that really excites me. And I think when I start to share some of the stories with you later, you'll probably pick up on that. And also, I'm a husband, and so when my wife says things like, I'm uncomfortable. I put that on the male discomfort rating scale, and I realized that she's actually very uncomfortable, or what I would call very uncomfortable. So I'm very sympathetic to that. So again, not the face you might expect on a discussion like this, but I think I have, in our experience here, some things to say that I think can be very helpful.
Great. Thank you, Jack. We are glad you're here. All right. So our objectives today are, first of all, just to review some general perimenopause and menopausal information, defining those type of classifications, sharing some symptoms, reviewing women's increased risk for chronic disease during this time of midlife, discussing the opportunities and roles of medical fitness in supporting lifestyle interventions that can improve women's health and life daily living during these times as well. So we'll jump into things. I'll start us off. Excuse me. So perimenopause and menopause. Perimenopause can start as early as the late 30s in some women, but typically is happening by 40 or the early 40s. It can last up to 10 years, this wonderful time of transition. And then when a woman has truly been without a menstrual cycle for a full year, she is classified as completely menopausal. What's happening is this declining estrogen and progesterone, particularly testosterone. Yes, women do have testosterone, and those levels are dropping as well. So you often hear women describe these out of control feelings, like their bodies betraying them. Nothing makes sense in how they're feeling physically, emotionally. And that's because there's just so much change happening. And because it's so dramatic, for some women, particularly, it can really negatively impact quality of life. And with or without strong symptoms, their long-term health risk factors are still increasing. So what is happening? I just thought this was a great visual. It's actually from an older study from a Women's Health Watch study, but it outlines like when a woman is younger and before she launches into perimenopause, we have these four female-based hormones: estrogen, progesterone, follicle stimulating hormone, and luteinizing hormone, that are in some kind of cyclical rhythm. They are happening on a monthly basis. Their elevations, their declines. But then once a woman hits perimenopause, just all bets are off. It's just crazy fluctuations. In fact, many physicians are not even checking women's hormone levels like they once did during perimenopause, because they can check them 1 week and then literally the following week they'll have different levels because of this unique fluctuations that are happening. So they're now much more dependent on women reporting symptoms and listening to what those women are experiencing. And then I think post-menopause, where we're actually now without a menstrual cycle for at least a year, we're flatlining, right? That looks dramatic, but this is where our hormones are no longer fluctuating. They're very low. And so these are just some nice visuals of what's happening during this process from pre-perimenopause all the way through post-menopause. So each woman's journey is different as they hit this midlife change. Right now, some of the newest research, and again, research is exploding, conversations are exploding around this area. There are over 100 identified symptoms of perimenopause and menopause. I'm going to share, these are the top 14 reported symptoms that many women feel. But again, each woman's going to be different, and the severity of the symptoms are going to be different for each woman. But we're talking about headaches, hot flashes, which are a vasomotor response. If you've had one, you know what they are. Joint pain, it's not related to arthritis or an injury. It's just achy hips, achy knees, shoulders. Frozen shoulder during perimenopause is a real thing. Weight gain, urinary changes. So we're talking about more incontinence or urgency, and increase in urinary tract infections. Everything is dry or drying out. Your skin, your hair, eyes, vaginal dryness is very common. Sleep disturbances are huge, not just because there might be some hot flashes that are disrupting it, but difficulty falling asleep, waking up for unknown reasons, and then not being able to go back to sleep. Women do report heart palpitations. Typically, these are benign but scary and disruptive to their days. Mood swings, overly emotional about things that they typically wouldn't have been emotional about before. Sometimes that impacts relationships, both personally and professionally. Anxiety, depression increases during these times. And I've had a few folks share with me, like they feel like they just have this smoldering or simmering anxiety like all the time, and it's unsettling as well. Decreases in libido, brain fog. If you want to have a good time, get a bunch of perimenopausal women together and talk about the silly things that have happened in regard to their brain fog. I had a friend that just recently shared that she had used laundry pods in the dishwasher for a week or so before she realized what she had done, until her husband started complaining about the flowery smells of his coffee mugs. Did she realize that that had occurred? And we can kind of laugh about it, and sometimes that helps. But if you get a bunch of women together who are going through it, we have a bunch of great stories. Periods are irregular, sometimes missing, spread out, closer together, heavy, they're just not typical. And then GI symptoms are certainly on the rise during this time. More bloating, more just discomfort, different food intolerance seem to arise as well. So having said all that, like, what do we know about supporting this time of life? Well, we do know that lifestyle strategies can help significantly. And really those are what we're going to dive in today around nutrition, sleep, physical activity, support and community, and finding tools to manage stress. So, and we're seeing more and more data about the power of these, and medical fitness certainly has a prominent role in supporting lifestyle strategies. Also, hormone replacement therapy can be a safe option for more women than we thought even a decade ago. So we really lost a generation of women to the opportunity to use hormone replacement therapy because we were scared of it due to some poor scientific data. So we're not trying to scare women to hormone replacement therapy by any means, but we are able to offer women a more informed decision. It's a personal decision. Each woman needs to be evaluated with their providers to assess the risk. But more and more women are candidates for hormone replacement therapy if that's something they choose to explore. So long-term health risk factors. I just want to be clear here. Once a woman starts into perimenopause, she is in a rapid aging state. I know that sounds weird, but it's super true. It's a much more rapid aging process than men experience, even though they do also experience hormonal shifts as they get older. But once we hit it, it's an incredible, in that first decade of changes in hormonal levels, we see incredible changes in our biomarkers, our health risk factors. And I think that is something we don't highlight enough on what's happening during this rapid aging time. So first one, increased cardiovascular disease risk. Elevated LDL and triglycerides seem to be the lipid markers that are elevating most quickly. I've had clients who 2 years earlier had beautiful lipid profiles, and now they're on a statin drug because of this significant change, barring no other changes in their exercise, their diet, or anything. We've seen blood pressure start to trend up during this time too, again, despite any changes in lifestyle factors. And then, of course, weight gain, particularly around the central abdominal area, is a significant, not only a cardiovascular disease risk, but something that women are finding very uncomfortable. Along with that, we see decreased blood glucose regulation. So insulin resistance is increasing or becoming more common in women in perimenopause as they move through these perimenopausal years. Particularly when we follow data of women wearing CGMs, non-diabetic women wearing continuous glucose monitors, We see this tracking in the evening hours, particularly. We seem to have more insulin resistance. We're just not as efficient in metabolizing and dealing with carbohydrate as we are at earlier times in the day. And all of this puts us at increased risk for prediabetes and type 2 diabetes as well. And then, of course, estrogen protects our bones. So as it decreases, we are now more at risk for osteoporosis and have to be strategic in maintaining bone health. And actually, our gut biome changes during these times too. And there are actually estrogen-producing parts of our gut biome that help clear excess estrogen, and those are impacted during perimenopause and menopause. And that's why there's often more GI symptoms. Women feel like they have more food intolerances, they're more bloaty and uncomfortable. And then finally is sarcopenia, this loss of muscle mass that happens to everyone as we age, but it is extremely accelerated for women compared to men again in these perimenopausal, menopausal times. So those are some really important things that I think it's good to focus on. So what can help? We said earlier, lifestyle strategies can be incredibly impactful to improve quality of life. So today we're going to talk about nutrition strategies, quality sleep, physical activity, and then the importance of support and community for this particular demographic. All right, nutrition strategies. First of all, most of us in medical fitness have either RDs in our centers or we have access to RDs within our larger healthcare systems. Super important to collaborate and have them part of the team when you're working with these particular clients. Scope creep is real, so we want to make sure that the right people are working with these clients. So don't forget to bring them into your teams. And just some general recommendations. We're really trying to move women who are typically carbohydrate-focused eaters, we're carb-centric eaters, to move them to eating their protein first with early goals of 80 to 100 grams a day, but these need to be individualized as well. And then in support of bone health, we're talking about calcium, vitamin D through dairy or fortified non-dairy substitutes, greens, and other fortified foods. Healthy fats, remember everything feels dry. So those healthy fats, omega-3s and monounsaturated fats that might come from fatty fish, flax, chia seeds, nuts, avocados, olive oil, those are some examples, can be very beneficial. And then again, in lieu of like this dryness that we're experiencing, being more intentional around hydration. 2 to 3 liters of calorie-free fluid per day is a great place to begin to work your way up to. Most of us run around mildly dehydrated anyway. And then limit alcohol intake. One of the things that you'll hear across the board, women become much more sensitive to alcohol during perimenopause and menopause. We flush, we're much cheaper dates. We just react differently to exercise than maybe we did before. And alcohol calories love the central abdominal area of our bodies. So limiting that can also be beneficial. And we're learning more about alcohol's role in cognitive health. So if we're going to have challenges with that anyway. So limiting alcohol can be beneficial. And then I want to highlight phytoestrogens in foods. These are foods that really do help provide an estrogen-like experience when people eat them consistently. So this may come from food sources that include soy protein, like soy protein powders or plant-based protein powders, meal replacements with soy in them, protein bars with soy protein in them. But it can also come from whole foods like tofu, edamame, flax. And then people are surprised that there are phytoestrogens in chickpeas, garlic, dried fruit, other cruciferous vegetables, berries, and things like that as well. And then I have a few clients that have really found benefit from doing an intentional pre-bed after like evening tea. I'm just sharing this for general information. It's a soy milk with maybe a little vanilla extract, cinnamon, ginger, and turmeric, which are anti-inflammatory. Warm it up and have that before bed, especially if an individual is prone to hot flashes. Can really reduce some vasomotor symptoms like the flashing and the heat feelings. And then supplements. Ideally, we try to maximize food whenever possible, but we do know that supplements can help in this particular time of life. Creatine, for this particular population, the research is growing around its benefit. Magnesium, fish oil, B vitamins, and then some L-theanine, pre and probiotics, maybe some others too. We want high quality supplements, so happy to share some of my favorite brands on those, but these do need to be individualized depending on the woman and the symptoms that she may be experiencing. And then I want to highlight this real quick, avoiding fasted exercise. This is a bit controversial, because we have seen a lot of hype around doing fasted cardio or fasted HIIT training. When women go through perimenopause, our baseline cortisol levels are increasing. So we are in a semi-fight or flight state all the time because of this increase in cortisol. And when we go ahead and try to exercise, particularly with any intensity, without having some food in us, we see an extra spike in cortisol. And all of this is inflammatory, and not really good for our health. So fasted exercise may work for some populations, but the research is leaning towards having nutrition before exercise. Ideally, 30 grams of carbohydrate and at least 15 grams of protein before. So pre-exercise, carbohydrate wins on the ratios between carbs and protein, a little more carb than protein. And then the after exercise recommendations are to have protein lead, can potentially have some carbohydrate, but we want to recover, especially as we get into some of the exercise recommendations Jack's going to share we're going to recover with a little bit more protein. So I want to share that too. And then sleep. Sleep has, I'm just going to move through these here. Sleep has been moved up in the last decade. The science around sleep is incredible. It is foundational. So when women aren't sleeping, we're not our best at home. We're not our best at work. We may not be the best at the gym. And so it's really important to try to go towards those core things that we know can help sleep. And it doesn't help for everyone. I'm going to highlight a favorite hot flash hack if you have clients or anyone here is experiencing hot flashes at night. Bamboo sheets are incredible. They are dry. They kind of wick away moisture. They're cooling. That's really helpful. And then things that also interrupt sleep that most of us are familiar with if we're in healthcare. But I have even started to look at wearing like blue blockers to watching TV at night before bed. It's not just for, these are blue blockers that I wear every day to protect my eyes for sure during the day. But as I'm winding down, I've added them to some of my other routines. And then getting natural light whenever possible as you head into the day, because that just sort of helps set that I'm awake now and I'll have a sort of an awake sleep cycle established. And then one other thought is, as medical fitness professionals, I don't think I'm just saying I haven't, and I've talked to other colleagues and they haven't. We haven't been as aggressive or proactive in talking to people who are members, our clients, around what's their sleep quality. Whether it's when we take an intake before they become personal training clients or before they join one of our programs. I think we could do a better job assessing sleep, because again, it's so foundational and can impact so many things. And we may be able to intervene and support them in a way if it's identified early on with their time with us. So we have nutrition, we have sleep, and then I'm going to turn it over to Jack for some physical activity focus.
Thank you, Raina. We know that there's a lot of benefit to be derived from exercise, and I want to go through a few here. Improve sleep. Basically, most of the things that you saw on the potential issues with menopause, you'll see that these can be helped and in some cases partially reversed with an exercise program. So reduced anxiety, preserving muscle mass is one that we're going to focus on when I get into a recommendation for the type of exercise to do. Improved cognitive processes. I will tell you, just cramming last minute, I ran across a study on this that I would be happy to share. If any of you are interested in seeing it, you can send me an email and I'm happy to send you the link for that. But it was really interesting that the type of exercise that I'm going to recommend in a few slides here actually shows that cognitive function can improve for years as a result of that type of training. So we're going to get into that in just a little bit. Improved balance, rebuilding confidence. That's a very important one. I've got several stories to share, but I wanted to mention one here. Mary is one of our 70-year-old clients here in our facility. And I mentioned this to Mary Ann before we started, that my office here is a little bit of a fishbowl with a glass wall. Mary just did a triple with her deadlift at 70 the other day, and she celebrated by stopping in front of my window here and doing a double bicep pose and showing me how much stronger she was getting. And so there's a lot of confidence that can come with women learning they can get strong, and being strong is much better than being weak. And so they're very excited about that. Reducing hot flashes, preserving bone is huge. There's several things that we're going to talk about upcoming that I think you're going to be excited about. And then reducing urinary incontinence also. Those are all benefits of increasing your physical activity. So next slide, please, Raina. So now my question here will kind of stir a little bit of controversy probably, because when I say, are we doing what is best? As we know, getting people to adopt lifestyle change is difficult. And so in one way to answer this question is whatever they will do is what's best. And there's some truth to that. I mean, we want people to become more active. But I do think in our situation here, and just what we've seen over especially the last 10 years, I think we know a few more things about how to prescribe exercise for this population that's going to help address the specific issues that they deal with. So obviously being more active is better than being less active, and being active is better than being sedentary. So if you can get people moving, good for you. But I do want to share some stories, and I want to share some examples here of a couple of forms of exercise that I think has been shown with our people and our clients to be extremely helpful. One of them is HIIT training, and HIIT training has many benefits. I mentioned earlier a study that I just recently ran across, be happy to share it, that shows immense improvement in cognitive function, which I don't even have listed here, but better vascular compliance and theoretically better blood pressure control in that situation, better glucose control is also an important benefit. And then also another little thing that I threw in is real strength training, and we'll talk about that in a second. Real strength training reduces muscle and bone loss, improves brain health, and reduces risk for falls. That's just a few of the many benefits, and we've already talked about some of those benefits. So what I would say is that the two things that I want you to think about as a result of what I'm about to share with you is, number one, intensity is not your enemy. Intensity is a good thing. And we're going to talk about that. And the other thing I want to mention is that strength training, real strength training, is key for this population. And I want to bring up a couple of stories here. The photos that you see on the screen, those aren't stock photos. Those are photos of participants in our strength and conditioning program that we have here. Faye on the top is 70 years old. Laura on the bottom right of that is 60 years old. Now, if you've ever taught someone to squat, especially a sedentary person, you probably can relate to how good their squat positions are. Faye's torso is probably just a little bit forward of where you'd want it to be, but she's 70 years old and she has great depth on her squat. And this was their deload day. So they're going to be pushing some heavy weights and lifting some heavy weights. Today was the light day for them, but they lift heavy weight, and heavy is a relative term. So if we could go to the next slide, Raina. So when we talk about these types of training, the first one I want to bring up is HIIT training. So here we want to be creative. Again, it's not a one size fits all. We want to pick different kinds of activities, sometimes maybe even a sport activity that might allow for high intensity intervals. Now, the way those intervals can work, you can start off with, and that goes to my next point, is start off with where they are. You can start off with any activity and just for 10 to 15 to 20 seconds, boost that intensity for a brief period of time, bring them back down, let them recover, staying active, but let them recover for 2.5 minutes or even more, and then gradually using that RPE scale, help them learn what exertion feels like. And as you know, if you've taught exercise to people before, that's a big thing that you have to really spend some time with. Remind them that it's not any one thing, but it's how warm they feel, how hard they're breathing, just their general feeling of exertion. Have them begin to rate that. And then when they feel different levels of intensity, they'll notice that that's different, and they'll be able to see that and be able to rate that differently. So again, beginning where they're at. Now, over time, you definitely want to get to the point where you maybe get to a 1-to-1 or a 2-to-1 work to rest ratio on your HIIT training. And one of the beauties of HIIT training is it doesn't have to be very long. You can have improvements in VO2, you can have improvements in muscle mass even some HIIT training has been shown to actually help preserve muscle mass. So there's many benefits, and the intensity is high, so the duration does not have to be as high. So there are really effective HIIT programs that are as few as 4 minutes. Initially, with people not being able to tolerate necessarily the high intensity right off the bat, it may take a little bit longer. You may spend 4 or 5 minutes warming up and then do 6 or 7 repeats of just asking them to surge a little bit in their intensity, again, with a couple of minutes or a minute or so of rest. So that might be where you begin. And so that would help you with your HIIT pro training. The 2 ladies I mentioned, and another one that I'll mention here shortly, that represents a very large part of what their training is in our strength and conditioning program. And as it says, strength, the next piece is real strength training. And one of the things I want to say here is that frequently we call strength training anything like a band or a small dumbbell that a movement is done, maybe a curl or a press or something like that, and we call that strength training. But as we all know from our backgrounds in exercise phys, the overload principle requires that we actually push beyond what our body's capable of, or at least up to that point. And it's not that complicated. We do a lot of compound movements in our strength conditioning program. We do push and pull in the vertical and push and pull in the horizontal. We lift heavy things off the floor and we squat. So those are very simple things that are all compounds, so they're moving a lot of muscle at one time. But the key and the goal is to achieve a max effort. And that's the part that it takes some education. Many people and if you've taught exercise, you've heard this phrase before, low rep or high rep and low weight. And what that really means is low effort. Because if you've ever trained somebody and you've actually done high rep with high effort, you know that it's one of the toughest things you can possibly do. And I'm not even recommending that. What I'm suggesting is that, again, in Faye and Laura's case, they do all the way down to triples. So they'll do 5 sets of 3 on their heavy week, and then they'll ramp back up or down depending on what their training coach has them doing. But the idea is that last rep includes a rep that would be considered an 8 or a 9 on an RPE scale. And there's a lot of you can find online some good feedback on how to use RPE in strength training. A good rule of thumb is if you're a 5, you've got 5 more reps in the tank. And it takes a while to figure that out. You have to work with them to get them to that point where they can make that judgment. But if you're a 9, that means you might have one more in you, or that might be it. So that's what you're aiming for, is at least on that last set to have a max effort. And I'm telling you, for this population, there's nothing more exciting than seeing folks improve in this area. In our strength and conditioning program, we have women in this age group who do their first pull-up. And honestly, of all the things that gets me super excited is when you have those ladies come to you and they have tears in their eyes and they've done their first pull-up and they realize how strong they can get. That makes this all worthwhile. And it's and when I say best, I do think, and I do believe that strength training as the foundation for this population, and then HIIT training, maybe thrown in with some other things, is really what is best for this population. Use the most weight possible with good form. And that's, again, a tough thing. You have to have coaching. You have to have our personal trainers are great at this, but it does take a lot of engagement with our people to do this. Okay, next slide, Raina. So last thing on my list, or last story, is Lisa. Lisa came to us from a program that did a low intensity, low effort circuit. She did it for many, many years. She did programs even in our facility that were low intensity. And then one day we brought pickleball to our facility, which I sometimes regret but I will tell you, it clicked something in her mind, and she was willing to work harder for short bursts to score those points than she was to do exercise for the sake of exercise only. And this clicked with her. And that's what I mean about being creative. You don't know what it's going to be. You have to have variety in your programming so that you can find that stuff that people really love. After being here for a good year or two, she started playing pickleball on a regular basis. In a year, she had lost 35 pounds. Now, people will say pickleball has a high injury rate, and it does. But having 35 extra pounds also has a cost. So that's something to consider. And not only that, she enjoys it. She does it every day. So again, finding that stuff, finding the things that people really love and that click and that help motivate them, I think is what you have to do. So next slide. All right, so where is our role in all of this? The first thing, it's interesting that this is in quotes, the health home, and we are. That's what we do. I do, and this is maybe not a popular thing to say in a medical establishment, but in my view, we do healthcare. We help people improve their health every single day. Our counterparts in the hospital, they're there for illness and sickness and all of that, but our goal is to really foster health, and that's what we do every single day. And actually, on this one subject too, that's another reason why I think we're very well positioned to help in this population, because it's not considered a sickness or an illness. And so a lot of times, in my experience, just talking to other women, some physicians don't really pay much attention to this. I think Raina kind of mentioned it earlier too, is that, and so that's where we come in, is we can provide that in this situation. We are committed to long-term engagements. I had Faye and Laura up on the screen earlier. They've been members in our program, in our strength conditioning program, for 10 years, but they've been here in our facility for 17 years. So when you see somebody for an hour a day, 3 days a week for 17 years, that's a relationship that's special. And you get an opportunity to really get close with them and help them in these things. We're retail business. We're very customer focused. We live with these folks every day. And that we're able, because we're retail, to react quickly to things that they might need. We are connected to a healthcare community, which allows us to utilize additional people in our facilities. We have physical therapy located here in our facility. So it's really very common for us, if we have a strain or something that we need a quick injury assessment on, we can take them next door and grab one of the PTs on their rare moments when they don't have a client, and get some help with that. And that working with our counterparts in those areas, I think it brings a different level of experience for our customers. Knowledgeable and credentialed team members. For many of my team members, this information that I've shared, especially making strength training and HIIT training a foundational thing for this population, they do that every day. They're fully aware of the information that this is the way to train this population, and they've been doing it. As I've been preparing for this presentation, I've gone out and talked to several of them, and they're like, "Oh yeah, Jack, we knew that." So we've been doing that for a long time. So we change lives for the better. Again, like I said earlier, that's the thing that gets me excited, is seeing these ladies facing endocrine disruption. That's one of the hardest things to deal with, and they don't just get through it, but they actually thrive and they actually overcome, and that's exciting stuff. And there's revenue opportunities all over the place in this situation, again, through referrals when they're necessary, but also additional services that we can bring to the table. All right. Some other things that we like to do is hosting seminars and information, providing weighted vests. I didn't mention that when we were talking about exercise, but actually using weighted vests and even heavy backpacks when hiking is a good way to put some extra stress on those bones to help preserve bone mineral. We do actually have those here, so we check those out all the time. Specific social media posts that deal with this topic. We do that incidentally on a regular basis. We don't always point out the specifics of people's current condition, but we do this. And then referring, as I said earlier, referring to these other areas that, mental health. I just had a conversation with a local mental health group about there's several issues, including weight loss and even issues in this area that frequently fall outside of our scope, and we need somebody that we can lean on and get those referrals out to. So we're going to increase our connection with them so that we have them as a resource. Offering incentives. We do have several programs that we offer that we kind of bundle, so that allows us to get people more engaged, but also to find a way to discount some of those things so that they're fully engaged. If we have a weight loss program or something like that, we make membership the next logical step. And we do that by allowing them to level up to that at a lower rate because they're already participating in another program. And then training our teams. I think that's really important, making sure that they are constantly out there looking for what is best. And really, one of the things that is critical here is not just getting information from the ivory tower, but paying close attention to their participants, their clients. Because like I said, these are long-term relationships. They know things that nobody else knows about these people. And they're really in a good position to be a real health advocate for them.
Great. All right. Thank you, Jack. That's all awesome information. We want to make sure we have some time for questions, so I'm going to wrap us up with some final thoughts. As we look at this demographic, and as Jack mentioned what a large percentage he has in his centers of women who are 40 or older, and I actually would encourage you to check your own member bases and look at what percentage of your clients are in this demographic. And then look at what you're offering. And do you have at least an equal percentage of what you're offering to address these particular groups? And also reminding us that these are also the primary healthcare decision makers in families. And so when we have those relationships with them, and we talked about the opportunities for downstream revenue and really providing this continuum of care, they are people that when we loving on them and they're accomplishing great things, they are lifetime committed to not just our centers, but our organizations at large. So that's important. But I really want you to think about, do your approach, your services and programs, send a personal outreach. I mean, we could argue that everything Jack said and that I've mentioned is really good for anybody, right? These are things that are good for anybody. But with this particular demographic, and we're feeling more heard, and I can say that because I'm part of this demographic, making the offerings feel like a personal outreach, that I'm being heard and that you understand and are addressing what my challenges might be, how I can get through them, that there's support there. I think that's really important. So what you're offering in your centers, sending a personal outreach if we're talking about this large demographic? Are your offerings encouraging sustainable lifestyle changes and really making impact on the daily living quality of life component that is a part of a real struggle during these years? Are we identifying barriers and potential challenges with our clients? And then, like Jack said, making the appropriate referrals. Are we thinking about mental health? Are we aware of emotional health? This can be part of team training as well, that this is an intense component of this endocrine disruption and that we are aware of it. And I love what Jack said about partnering with more mental health practitioners with his team. And then, are we encouraging regular check-ins with their healthcare team? That's one thing I think a lot of women can feel dismissed by healthcare providers, or they cannot share actually what's happening with them. And our teams in the medical fitness center may actually be seeing them, like Jack said, on a more regular basis than any other healthcare provider. And we need to sometimes encourage them, hey, you've been sharing that this is an issue for you. You're not sleeping well. We've talked about it a few times. We need to get you back into those healthcare teams and make sure that they're being supported in every way possible. So as we kind of wrap up here today, are we addressing this demographic in ways that feels personal? Are we looking for sustainability? Are we helping them identify and work through challenges and barriers? Are we making sure that we are looking at this holistically with mental and emotional health support and then additional like ongoing support? So those are sort of our final things there to highlight, and we are now open for questions, and we'll leave up our contact information here too if something comes up that you'd like to reach out and get more information on.
Awesome. Thank you so much. So if anybody has any questions, you can go ahead and type them into the chat or into the Q&A section. We'll see them both. So either or. That was fantastic. Thank you so much for sharing your knowledge with us today. And just as we're waiting for questions, I'll just let the attendees know that everyone will receive an email with an evaluation link for today's webinar. And it does include a spot to indicate which CECs you'd like to receive. So please be sure to complete the survey. Even if you're not looking for a CEC, your feedback helps us in planning educational webinars, helps our speakers with their presentation skills, although you guys did an awesome job. I also want to say thank you to our webinar sponsor, Health One. You can visit them online at hnthealth.com. That's hnthealth.com for more information about creating engaging programs together. It's great. I keep seeing all these emojis flying up. I'm getting distracted. Ashley said, thank you so much. Stay tuned to the MFA website. We've got more webinars coming through the pipeline. We also have 3 medical fitness summits coming up in April, May, and June. So definitely check out the website for those locations. It's a great time when we can all come together. We've got some more thank yous. Philip says thank you. It was a great information and excellent presentation. Jenny says, thank you, Jack. You are so right. It is so rewarding to feel the excitement when women feel so strong. And Jennifer says, thank you, Raina and Jack. Great info. Yeah, just lots of thank yous. And again, everybody, the information is here. And Jack, if you want to share that link to that study with me, I can send it out to everybody on the list. That's fantastic. Or folks, you can certainly get in touch with Jack directly.
Yeah, please reach out we have our emails here, or connect with us on LinkedIn. Yeah, we are excited to be able to have the opportunity to share this information. It is, if it's not flooding your social media and you're not seeing, all of the highlight on women's midlife health right now, it's exploded this past 2024. And although, again, we are doing wonderful things for all of our members, I think it's really great to make sure you're seen as an organization that too is highlighting women's midlife health. And that's an important place to find yourself, or a place to position yourself from a business standpoint as well.
Yeah,
Awesome.
Raina, kind of on that, I just wanted to add one thing that I didn't mention, which I think is really important. The examples that I gave, the three women that I mentioned, they're in programs that actually include other women in that same population. And I think that's also super important. I mean, they definitely gain strength from each other and that community and that kind of club within the club, like allowing them to create those relationships is also huge to really keeping them engaged.
Yeah.
Exactly.
Sure.
And I mean, it's such a great retention tool as well. As you've mentioned,
Mm-hmm.
these women have been members for 17 years. I mean, just, those are amazing numbers. Cassandra said she would definitely love the link to work out. So yes, Cassandra, we will get that out to everyone. More thank yous coming through, which is great. I'm not seeing any further questions. I think you guys must have covered everything.
Oh yeah, if something hits you later, please reach out. We'll be happy to answer any questions going forward too.
That's
Yes.
awesome. Yep, I'm loving all the emojis coming up. So as I said, stay tuned to the MFA website for the upcoming webinars. Check out our upcoming summits. If they're near you, those are happening in April, May, and June. And then we'll have our annual conference in November again. So without seeing any more questions, I will say thank you again, everyone, for joining us today. And certainly a big thank you to Raina and Jack for sharing their knowledge with us today. This was wonderful. And with that, I'll say enjoy the rest of your day.
Thank you, everyone.
Bye-bye.